Hello, and welcome to another episode of Wellness Wednesday with Dr. Latoya Wells. For those of you who don't know me, I am Dr. Latoya Wells, Doctor of Nursing Practice, family nurse practitioner, and owner of Wells Legacy Health and Wellness. It is so good to be back with you all this week. I missed you last week, but we're here and we're going to discuss an important topic, one that has impacted many lives, individuals that I know personally, my family, friends, colleagues, patients that I've taken care of. March is a month where we talk about, highlight, discuss the ins and outs of colorectal cancer or colon cancer, the impact that it has on the many lives of people who have dealt with this disease, who are currently dealing with it, who have just been diagnosed, who have overcome colon cancer, and those who lost their battle to colon cancer. So I want to take a few moments just to remember those who lost their battle to colon cancer. There's so many people who have been impacted by this disease, and as we know, screening is key. Preventative care is key. However, even with that, some individuals developed this nasty condition and lost their life to it. I also want to highlight those who are warriors of colon cancer, the ones who received the diagnosis, went through the treatment, and came out on the other end cured of this disease. There's so many different things that we can do as individuals when it comes to our health and wellness. We're going to talk about that tonight. So March is colorectal cancer awareness month, as I mentioned. It's a critical time. We're going to provide some education, and I want you to take action to make sure that you're living a healthy life. We're going to go over some statistics talking about how many people in the United States have been diagnosed with colorectal cancer, those who are projected to develop this condition. Also discuss some of the different things that we can do from a health and wellness standpoint, diet, exercise, all those things that can help you decrease your risk for developing colorectal cancer. So, colorectal cancer, what is it? It's a type of cancer that starts in the colon or the rectum. When we look at the human anatomy, the colon and the rectum is the colorectal part of the body. And this is where colon cancer develops. It often starts off as a polyp, which is a really small, almost if you can think of a raised mole on your skin. It looks similar to that, or a little ball or bulb that develops within the colon or the rectum. And if not removed, if not watched or surveillanced over time, it can become cancerous. Not all polyps turn into cancer, but there are some that do, as evidenced by the numbers that we're going to discuss here later on. Some signs and symptoms of colorectal cancer. Some of the common signs and symptoms is change in bowel habits. So if you usually have regular bowel movements every day, now you have some diarrhea, constipation, the consistency of your stool changes, the color of the stool changes. You may notice some blood in the stool or some rectal bleeding. There may be some unexplained weight loss. You're not doing anything to lose weight. You're not dieting, you haven't changed up your exercise regimen, you haven't done anything extreme, and you're noticing that you're losing weight. Persistent abdominal pain and cramping. Also, bloating is another thing that we have seen in individuals who have been diagnosed with colorectal cancer. Feeling like the bowel doesn't empty completely. So after you go and you have a bowel movement, you're still feeling full. There's some warning signs that we want you to pay attention to, and that if you develop these, we want to make sure that you are seeking immediate care. So one is severe stomach pain, chronic fatigue, unexplained anemia, meaning low iron levels. There's nothing else going on. There's no active bleeding. You're not a woman who's having heavy menstrual cycles, things like that. You don't have any other hematological or blood type of disease going on that would impact your iron levels, and still your levels are going down and you've been diagnosed with anemia. Some of the risk factors for developing colorectal cancer. One is age. So individuals over the age of 45 are at a higher risk for developing colorectal cancer. Your genetic makeup, so family history. So if you've had a parent, a sibling, or a first-degree relative that has had colorectal cancer, you're at a higher risk for developing it. Your ethnic background. So if you are Black or brown, you're at a higher risk for developing colorectal cancer. Diets that are high in red and processed meats, that you have an increased amount that you're eating, if it's something that you eat on a day in, day out basis, that puts you at a higher risk for developing colorectal cancer. It's linked to a higher risk of developing this cancer. Obesity and a sedentary lifestyle. So lack of physical activity can also increase your risk. There's several other things that play into it, and smoking and alcohol use are both linked to increased chances of developing colorectal cancer, as well as inflammatory bowel disease, Crohn's or ulcerative colitis. I can't talk tonight. Raises your risk for developing colorectal cancer. So if any of these things stood out to you, if you meet the criteria for any of these things, I want you to take it seriously and think about getting screened, especially if you have a family history. If you have any of these signs and symptoms, things just don't seem right, seek medical care immediately. So according to the American Cancer Society, over 150,000 new cases of colorectal cancer are expected in 2025. That's 2025 alone, 150,000. But regular screenings could prevent 60% of deaths. So of this 150,000 individuals, 60% of those could prevent dying or developing late stage colon cancer just by getting screened. Colorectal cancer can be screened several different ways, and we're going to discuss that in just a little bit. But how do we prevent it, and what are some of the wellness things that we can do to get ahead of a diagnosis of colorectal cancer? So one, screening and early detection. Colonoscopies can detect and remove precancerous polyps. Starting at age 45, individuals are recommended to get their screenings, and it will depend on what is found, your family history, in regards to how frequently you should be getting your repeat colonoscopies. There are different at-home test options. You have a IFOBT kit, which is a little kit that you'll use, and you'll take a little sample of your stool and put it in there. The other one is a FIT DNA test, and that's a different type of stool test that you'll do at home. They both look for something differently. The FOBT kits look for blood in the stool. The FIT DNA test actually look for the DNA of cancerous cells within your stool. So it's important to understand the difference of those tests. If you were to be ordered or given one by your primary care provider, be sure that you understand how to prepare for the kit, how to take the sample correctly, and when and how to ship it out. So that way you don't have any mishaps or any issues with that. Best case scenario, if you're prescribed an order to go and or referred to get a colonoscopy, follow all the steps for the prep to ensure that you don't have to repeat it. I can't tell you how many times I've heard of scenarios of where patients or family or friends that I know of and have talked to, and I've told them, you have to take all of the prep. There's many different preps that are available now. They all look different. However, if you don't complete the prep completely in its entirety, you're not going to get your system cleaned out, and they're going to have issues looking at your colon and visualizing the structures within the colon, and they may miss something. And if that's the case, they're going to send you back home and repeat that colonoscopy once you've gone through that prep again. For those of you who have gone through the prep before, it's not something that you want to repeat anytime soon, right? So make sure you're doing your due diligence to ensure that you are completing the prep and that you're getting your system as clean and empty as possible. Some of the other things that we want to talk about tonight is specifically diet and exercise. Diet is so important. Increase in foods that are rich in fiber, such as veggies, fruits, and whole grains. I can't tell you how many people, the number of adults that I talk to that don't eat vegetables. They don't eat vegetables. You'd be amazed. So increasing your vegetables, fruits, and whole grains is going to increase fiber within your system and help you with bulking your stool to have more effective bowel movements. Eating more lean proteins. We've talked about this before. The serving size of your protein should fit the size of your hand, the palm of your hand. That's the serving size. Everybody's hand is going to be differently. So that means each individual's portion of protein is going to look differently as well. So lean proteins are the fish, the turkey, the legumes, quinoa, things like that. Reduce processed and red meats. They are linked to higher cancer risk, not just colorectal cancer either, but other cancer risks. I know some people love their steak, and there's nothing wrong with that. But let's look at portion control and how often you're eating these red meats and the processed foods. Making sure that you're including the omega-3 fatty acids, which is found in salmon. Those have inflammatory properties that can help with inflammation. And many times when we look at the development of cancer, these individuals have higher inflammatory markers, their sedimentation rate, and other things that will indicate that there's some type of increased inflammation within their bodies. And staying hydrated. Water supports digestion and gut health. So when we think about bowel movements, and I know it's not something that we want to talk about, but we're going to talk about it tonight. When we think about bowel movements, there's different types, right? So when an individual is constipated, it tells us that they don't have enough fiber, one, and that they don't have enough water in their system. And so their stool becomes hard and clumpy, and they're passing these little balls, which is the constipation. So staying hydrated and making sure you're getting in enough fiber is going to be key. We talked about this time and time again, and I will continue to bring this to the forefront. Exercise and weight management are so important. How many minutes per week should we aim for? Did someone say 150 minutes of moderate degree exercise? You got that right. 150 minutes of moderate exercise per week. Walking, swimming, cycling, jogging, you name it. Walking up and down the stairs, whatever is going to help you get that 150 minutes of moderate exercise weekly, which is 30 minutes, 5 days a week. Whatever means necessary, get it done and get it in. Strength training 2 to 3 times a week is going to help with your metabolism, also with weight control, and also build bone strength, especially for women who are going through hormonal changes. Over time, our bones tend to become less dense, and we can be at a risk for developing osteoporosis, osteopenia, and things like that. So we want to make sure that we're doing strength training exercises that are going to help us with metabolism. You're going to burn more calories, and you're going to be able to maintain your weight. Staying active reduces inflammation and supports a healthy gut. I can tell you now, I've had multiple surgeries on my knees, and I find that if I'm not as active, my knees are so stiff and painful and sore. But the more active I am, the less inflammation I have in my knees. You would think there would be more with as much exercising and lifting weights as I do at times, but it actually helps. I feel much better when I'm moving around and walking and just being active versus sitting. I sit for work in this chair, sometimes 8 hours. I try and move and get up as much as possible. But when I get up, I notice a difference in my hips and my knees. They're a little stiff. So moving is going to be key for that. The next thing that we're going to talk about, and again, to each his own, I'm not saying that you can't indulge in alcohol. And for those who like to smoke, I'm not going to go get on my soapbox about that. You know how I feel, and you know what research shows. The proof is in the pudding when it comes to smoking and tobacco and all the other things that people are inhaling and putting into their lungs. But limiting alcohol and smoking is going to help. Reducing alcohol intake by 1 beverage per day for women and 2 drinks per day for men, or avoiding it altogether. making sure that if you're having an issue with smoking, seek out for support. There's the 1-800-QUIT line. There's all these different resources that are available. All you have to do is go on and Google, or speak into Siri, or whatever the Android thing is, and get some help with smoking, whether it's tobacco or excessive alcohol. These things truly increase your risk for developing cancer. So what are the treatment options for colorectal cancer? If there is a polyp that has turned into a cancer, when they're doing the colonoscopies, or if it looks suspicious, they're going to remove that. They're going to do a biopsy and remove that polyp, send it out, look at the cells, see what's growing, and determine if it's a high-risk cancer or high-risk cells that have a higher likelihood of turning into a cancerous cell. Then they'll remove it, and you may have to go in for additional surgery. So the surgery is going to be to remove those tumors or that cancerous area. Radiation therapy is used for rectal cancers and advanced cases. Chemotherapy is used to kill cancer cells and to prevent them from spreading. So prevention is key. Many times individuals who have colorectal cancer is found because there is a polyp that is cancerous, or it has a high likelihood of turning into cancer. And so screening is so important. If you have a polyp, they're going to watch it for some time to ensure that it's not changing, or they may choose to remove it at the time of the colonoscopy. It just depends on the scenario and what's going on. Immunotherapy and targeted therapy, newer treatments that help boost the body's immune system to fight cancer. I know that many individuals that I know of who have gone through cancer treatment, and they've received chemotherapy, radiation, they've also received immunotherapy and targeted therapy. That helps with increasing their immune system to help the immune system fight the cancer off. The earlier colorectal cancer is detected, the more treatable it is. And I just said that earlier. Over 90% of cases caught early are successfully treated, whether it be from a polyp removal, whether it be from a minor surgery to remove that cancerous tumor, or to remove part of the colon and allow it to heal, to remove that cancerous area out. But it's so important that we take time to take care of ourselves and make sure that if you have family, friends that you know of who are of age, or who have a family history of colorectal cancer, or are having these symptoms, some of the symptoms that I mentioned, it is so important that you encourage them to get screened. Also for yourself, to get screened. Many lives can be saved by simple screening and preventative measures by way of screening. And when I talk to patients who have developed colon cancer, and we discuss screening history and how often they've been screened and when they started screening and when they noticed symptoms, many times there's a huge gap in between. And it's remarkable that if they had taken a few moments to schedule a colonoscopy or have a conversation with their primary care provider to get an order for a colonoscopy, or to get an order for any of the colorectal screening kits, it could have saved them a lot of time and effort and a lot of heartache going through advanced aggressive treatment, because now the cancer has spread. If you are over the age of 45, schedule your colonoscopy. If you have a family history of colon cancer, schedule your colonoscopy. I'll share a little bit about my story with a family member who had colon cancer. My paternal grandmother had colon cancer, and she did not seek treatment. And it wasn't the cause of her death, but she was dealing with colon cancer at death. And because of that family history, I am at a higher risk for developing colon cancer. My mother and father don't have it, but there's still some percentage of family that has colorectal cancer. And so screening for me began a little earlier because I was developing some issues and we weren't sure what was causing it. And I can remember I had a student, Dominique is her name, was her name. Very young. She was in my nursing program. And she developed colon cancer at a very young age. And I mean, she was less than 30, so maybe 27 years old, and developed an aggressive form of colon cancer. Not sure how long she had symptoms or things that she was experiencing, but she lost her life to colon cancer, something that could have been treated. And again, I don't know all the ins and outs. I don't know all of the details. I just remember this sweet young lady developing colon cancer. And it was after she graduated from nursing school and was working as a nurse. And at some point found out that she had colon cancer. And I can remember speaking with her and just checking in on her to see how she was doing and if she needed anything. And the next week she was gone. Young. We are seeing higher rates of cancer in younger individuals than we've ever seen before. Stress plays a huge part on developing cancers. Stress causes inflammation in our bodies, and it just wreaks havoc on our immune systems. And so it's so important that we take care of ourselves and that we do our due diligence to get the screenings early ahead of time. And if something is found, if something is abnormal, make sure that you're following up on it. I want to encourage you to share this information. Encourage your family and your friends to get screened. Make sure you're putting into place healthy things that are going to foster or that are going to help you develop a healthier lifestyle. So making small changes in your diet and exercise for long-term health. Many times we think if we switch our diet up, and many times they're what we call fat diets. If we go on this fat diet, this juicing, and that's all I'm doing is juicing and smoothies and what have you, the intermittent fasting, you'll get quick results. However, it's the steady pace that wins the race. It's, when you speaking of the turtle in the hare, I don't know if you guys remember that story, but it was a turtle who won the race, and it was the steady pace that wins the race. And those things that you put into place and that are going to take time to develop are going to help you overall in the long term. Make sure you follow Wells Legacy Health and Wellness for more tips and consultations. If you are having any issues, if you have any concerns, book an appointment with us. You can book an appointment with us at wellslegacyhealth.com. And if you have not had your wellness checkup or your physical exam, we're here for you to get your annual physical exam done. So book your checkup today. You can book your appointment right on our website. If you have insurance, please give us a call and we can help you get your appointment scheduled that way. But if you are someone who is without insurance or you're self-paid or what have you, and you need to be seen, we can get you seen. Just go ahead and make your appointment. I want to just say thank you so much for being here. And I want to encourage you that if you have not gotten screened and you're 45 and older, it's time to get screened. Make sure you check out our website. Make sure you follow us on social media. I'm Dr. Latoya Wells with Wells Legacy Health and Wellness. Stay safe and be well. Until next time, we'll see you later. Go get screened. Bye.